One patient, two healthcare professionals. A 50-year-old woman is scheduled to have a hysterectomy later in the week. She is at the hospital for preoperative laboratory work and a chest X-ray. The nurse and phlebotomist are both in the room with the patient. The nurse is conducting a nursing assessment and reveals to the patient that the chest X-ray is abnormal. At the same time, the phlebotomist is ready to collect a blood specimen. Both healthcare workers can use a computerized handheld data entry system to access information and to enter information about the patient in an electronic format. In order to protect themselves on the job, phlebotomists should have which character trait? A. Propensity for cleanliness. B. Fear of infectious diseases. C. Expressing themselves loudly. D. Being suspicious of peers. Answer A. Phlebotomists handle blood and bodily fluids, which can carry infectious diseases. Maintaining cleanliness and hygiene is crucial to prevent cross-contamination and protect both the phlebotomist and the patient. A strong focus on cleanliness ensures proper use of gloves, sterile equipment, and disposal of hazardous materials. Clinical laboratory standards of practice in the United States have been established by which of the following organizations? A. FDA. B. CLSI. C. NRA. D. CMS. Answer B. The Clinical and Laboratory Standards Institute, CLSI, is a globally recognized organization that sets standards for laboratory testing procedures, including phlebotomy. They ensure consistency, safety, and accuracy across clinical laboratories. The FDA regulates medical devices and medications, but CLSI focuses specifically on laboratory practices. Which of the following tools is most useful for demonstrating steps in laboratory procedures? A. Fishbone diagram. B. Brainstorming. C. Flowchart. D. Six Sigma. Answer C. A flowchart is a visual tool that outlines a step-by-step process, making it ideal for demonstrating laboratory procedures. It shows the sequence of actions, decision points, and the overall workflow, which is critical in understanding complex procedures like blood draws and specimen handling. An example of an unfavorable patient outcome during or after a phlebotomy procedure would be if the patient A. States that he is fearful of the procedure. B. Faints after the venipuncture. C. Has a loud radio going in the room. D. Has several family members in the room. Answer B. Fainting, syncope, is a known potential complication of phlebotomy. It represents an unfavorable patient outcome because it can lead to injury or further medical complications. Fear of the procedure, noise, or the presence of family members are not directly harmful but should be managed to create a comfortable environment for the patient. Which of the following individuals is most likely to perform phlebotomy procedures? A. Office manager. B. Pathologist. C. Pharmacist. D. Medical assistant. Answer D. Medical assistants often perform routine phlebotomy procedures in clinics and hospitals as part of their role. While pathologists oversee lab testing and may supervise, and pharmacists focus on medications, medical assistants are trained to handle tasks like drawing blood and preparing samples for testing. An example of how clinical laboratory test results are used is A. Body mass index. B. Cataract screening. C. Monitoring cholesterol levels. D. Measuring heart rate. Answer C. Clinical laboratory test results are used to monitor various health conditions, such as cholesterol levels, which are critical in assessing cardiovascular risk. Tests like body mass index or heart rate do not involve lab work but are rather clinical measurements done without laboratory equipment. Specimen collection procedures are part of which phase of a laboratory workflow cycle? A. Pre-examination. B. Examination. C. Post-examination. D. Follow-up. Answer A. Specimen collection is part of the pre-examination phase, where the specimen is gathered, labeled, and prepared for testing. The examination phase involves analyzing the specimen, and post-examination involves reporting and interpreting the results. Proper handling during pre-examination is crucial for accurate test results. Which of the following is a characteristic of a pathologist's responsibilities? A. Daily rounds with patients. B. Treatment of conditions related to the respiratory system. C. Oversight of a clinical laboratory. D. Performance of point-of-care procedures. Answer: C. Pathologists are responsible for the oversight of clinical laboratories, ensuring accurate testing, quality control, and the interpretation of results. They generally do not perform daily rounds or point-of-care procedures, which are more related to direct patient care handled by other healthcare professionals. Which of the following is the main area of responsibility for every phlebotomist? A. Analytic testing. B. Data collection. C. Reporting results. D. Pre-analytic processes. Answer: D. Phlebotomists are primarily responsible for pre-analytic processes, which include drawing blood, collecting specimens, labeling them correctly, and ensuring they are properly stored or transported for testing. Analytic testing and reporting results are typically performed by laboratory technologists or pathologists. Part of being a responsible member of a healthcare team involves: A. Being confident at all times. B. Understanding the mission, goals, objectives. C. Always avoiding conflict. D. Sticking to a decision regardless of advice from others. Answer: B. Being a responsible team member means understanding the mission and goals of the healthcare organization, ensuring that your actions align with the overall objectives. While confidence is important, flexibility, open-mindedness, and cooperation with other team members are essential for providing patient-centered care. What feelings does one experience when a stranger gets too close for comfort? A. Anxiety. B. Joy. C. Confidence. D. Security. Answer: A. When a stranger invades someone's personal space, it often triggers a feeling of discomfort or anxiety. This response is a natural reaction to perceived invasion of personal boundaries, which can create stress or unease. The definition of culture includes which one of the following aspects? A. Anatomy and physiology. B. Hair and eye color. C. Traditions and values. D. Combined family salary. Answer: C. Culture refers to the shared customs, traditions, beliefs, and values that characterize a group of people. It encompasses social practices, religious beliefs, and languages, but does not include biological traits like anatomy or physiology. EMR stands for which term? A. Effectiveness of medical reagents. B. Electronic medical record. C. Efficient monitoring of results. D. Electronic medical research. Answer: B. EMR stands for Electronic Medical Record, which is a digital version of a patient's medical history. It is used by healthcare providers for better record keeping, tracking patient information, and improving efficiency in the healthcare system. Which of the following data should be considered confidential? A. Laboratory test results. B. Patient's Bill of Rights. C. Nonprofit status of the health facility. D. Universal precautions. Answer: A. Laboratory test results are considered part of a patient's private health information, which must be kept confidential according to HIPAA, Health Insurance Portability and Accountability Act, regulations. Protecting patient confidentiality is a fundamental responsibility of healthcare providers. What method for requesting a laboratory test is the most error-free? A. Handwritten requisition. B. Electronic method. C. Verbal method. D. Verbal stat method. Answer: B. The electronic method is the most error-free for requesting laboratory tests because it reduces the chances of misinterpretation or errors that can occur with handwritten or verbal requests. Electronic systems often have built-in checks to prevent mistakes in test orders. Which is an example of a barrier to communication with a patient? A. Sender. B. Decoder. C. Television. D. Supervisor. Answer: C. A television can act as a barrier to communication because it creates noise and distractions, preventing effective dialogue between the healthcare provider and the patient. Good communication requires a focused environment without external interruptions. DOB stands for A. Don't offer beverages. B. Date of breakfast. C. Date of birth. D. Department of Blood Work. Answer: C. DOB is a common abbreviation used in medical records and communication to refer to a patient's date of birth, which is important for verifying identity and patient information. Which of the following statements is appropriate during a phlebotomy procedure? A. This won't hurt a bit. B. Your name is Mrs. O'Brien, isn't it? C. You are required to cooperate with this. D. Could you please spell your last name for me? Answer: D. Asking a patient to confirm their information by spelling their last name is an appropriate way to verify their identity before the procedure. Saying, "This won't hurt," or demanding cooperation can be misleading or intimidating for the patient. Which of the following is a key element in effective communication? A. Active listening. B. Critical values. C. Eye-color distinctions. D. Point-of-care procedures. Answer: A. Active listening is a crucial component of effective communication. It involves fully concentrating on the speaker, understanding their message, and responding thoughtfully. This helps to avoid misunderstandings and builds trust between the healthcare provider and the patient. Slouching posture, a nonverbal behavior, conveys what message? A. Confidence. B. Pride. C. Laziness. D. Attention to detail. Answer: C. Slouching is a form of nonverbal communication that often conveys disinterest, laziness, or lack of engagement. Body language can significantly affect how others perceive us, especially in professional settings like healthcare, where confident and attentive posture is expected. If the patient's results are entered into the handheld device, who would be able to legally access that medical information? A. Any hospital staff member. B. Only authorized healthcare professionals involved in the patient's care. C. The patient's family members. D. Anyone with access to the hospital's network. Answer: B. HIPAA, Health Insurance Portability and Accountability Act, ensures that only authorized personnel involved in the patient's direct care can access personal medical records. Is it okay for the phlebotomist to collect a blood specimen while the nurse is conducting a health assessment? A. Yes, as it saves time. B. No, because it might confuse the patient. C. Yes, because both tasks are necessary. D. No, because it interrupts the nurse's assessment and the patient's privacy. Answer: D. Proper communication and focus are necessary during patient assessment. Collecting a specimen simultaneously might disrupt the nurse's assessment and make the patient feel overwhelmed or uncomfortable. Does the patient have to sign a consent form with regard to her electronic medical record? A. Yes, for any medical procedure. B. No, consent is implied by seeking treatment. C. Yes, because the use of electronic records must be approved. D. No, unless a third party is involved in handling the record. Answer: B. Typically, by receiving care, patients give implicit consent for the use of electronic medical records as part of their overall treatment, unless additional or third-party access is requested. Is this situation acceptable? If not, give some suggestions about how to improve it. A. Yes, this situation is completely acceptable. B. No, the phlebotomist should leave and return after the X-ray results discussion. C. Yes, both healthcare professionals can perform tasks at the same time. D. No, the phlebotomist should wait until the nurse completes the health assessment. Answer D. Patient care should be structured to prevent confusion and interruptions. The phlebotomist should wait until the nurse finishes the assessment and then proceed with the specimen collection to maintain a calm and focused environment for the patient.